We have a problem in our society. Not only are women aborting their children, but our older generation is giving up on themselves as well. I say giving up because they would rather have doctors assist them in their death than to let God decide when their time is. Doctors find that their patients are willing to discuss this option while they are currently healthy. At first, doctors and medical students were to embody the phrase, "first do no harm." Sadly, over the years, people have taken a liking to this option of euthanizing. I feel that this is setting aside a person's worth for what they consider to be better or the best option. A physician's opinion on euthanasia really does affect the patient. This will also affect the patient's view of themselves as a human being. Doctors are not there to encourage lethal drug usage and tell you it's the best option. They are there to guide you and help you understand what you are getting yourself into and talk you through some other options. The one reason patients consider this as an option is because they feel useless, unwanted, or feel as if they are a burden. Some feel that they are not cared or loved for. They need to know that death is not the only way and that someone does care and love for them. The actual assisted suicide itself is painless. There aren't any recordings of this because the pain was untreatable. The pain and suffering isn't anything like they advertise on TV ads. Some of these patients do not voluntarily take these drugs because their so-called loved ones are encouraging the drugs for their own personal gain. Their gain is inheritance, a life insurance policy, or just letting go of extra responsibilities. This is considered as elder abuse. Elders are also fearful of their doctors now. Since these drugs were legalized, patients worry if their doctors think it's even an option. These fears weren't present before the drugs and shouldn't be present now. Doctors should be considerate of their patients' wants and needs, not if it's time for them to let go of life. While these drugs are funded by taxes, some medications for patients in need are not. This goes to show that our elders are not being cared for properly. This is putting elderly lives at risk. So far, it seems that these drugs are in Oregon and being pushed into Washington too. How long is it going to be until every state? How long is it going to be until I'm pressured into euthanizing myself? This is what we need to ask ourselves. Another thing we need to ask is if the patient's family members are okay with them taking these drugs. We never think of the family members involved because we usually think they force this upon their loved one. Well, that isn't always true, and most families do care. Instead of putting a stop to euthanasia, officials are encouraging it. They go out of their way to defend these drugs in the practice. Patients have to go in for their medications and wonder if their doctor is going to suggest they start taking these drugs. This is a serious issue, and it has to stop. These patients with serious illnesses are being put aside as no longer treatable because their medications can't be paid for any longer, so killing them off is their solution. Instead of making this sound as terrible as it is, they advertise it as dying with dignity and aid in dying. They make it sound honorable and wonderful, and it's not. It's taking someone's life and convincing them it's about time. To access these drugs, you are to be sound mind, yet 25% of these patients suffer from depression. Other patients have anxiety. State officials also should have reports of this, yet only have second or third-hand reports. Most doctors aren't even present when the drugs are taken. These doctors receive a license to kill, yet they can't even be there when the drugs are taken. Not only don't these doctors supervise, but there is no punishment for failure to report. No one is watching or taking care of these people. Doctors are prohibited from recording assisted suicide as cause of death. Instead of their terminal illness is recorded as cause of death. In conclusion, I think euthanasia should be illegal. I feel as if it lowers someone's self-worth and that it just having this as an option gives a human being a way out of life just because they feel as if they aren't needed. It not only harms our elders, but the doctors and family and friends.